Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and Dental Sleep Medicine Insider. We're going to talk today about when you might want to add an anterior stop or not. We might also call this an anterior midpoint stop or a deprogrammer. First of all, let's talk about the physics here. Very quickly, I hope we all know that if we put a pivot point in the front and we put the force on our muscles, that we're going to exert a little bit more force on the joint, especially on a joint seated in the condyle. We also know that we might decrease the actual muscle activity. Now the question is, when it comes to a mandibular advancement device, does this hold true? And there's controversy on that. We do know that we will put less force because the pivot point being further away from the rotating axis. That much is true. Whether it decreases muscle activity or not, we could debate, but I've only got about 5 minutes to do this video, so we won't debate that today. So we'll get right into why you might do this and may not, and what the advantages of this anterior stop are and the disadvantages. The main advantage to the anterior stop is you're going to decrease the closing forces. You're possibly going to decrease the muscle activity, but for sure the amount of force we're going to put between the two arches is less. We're going to decrease the force on our back teeth because we're only hitting in the front, and we're closing with less overall force due to the pivot point, as we already discussed. It's going to be easier to deliver our devices. They're not going to need as much adjusting because they only hit in one spot as opposed to all the way around. And there's going to be easier adjustment as we go forward in occlusion, because as we move forward, the posterior is going to be out of occlusion. There'll be less areas to interfere. There'll certainly be more room for the tongue on either side, and the posterior laterally will have more room in the freeway space for our tongue. And we're going to have a lateral movement is going to be increased with some of the devices that we do, such as a dorsal design. And we're always going to increase the vertical dimension of occlusion if we add this deprogram, which may be an advantage in some situations. The disadvantages are we're possibly going to load that joint. Now we're not in the condyle. We've translated our condyles, and the forces may be less, but we still may increase forces on our joint when we add this deprogrammer or anterior stop. We may possibly increase the forces on those lower front teeth, even though the overall force may be less. Because we're only hitting in the front, those front teeth may in fact receive more force. So we need to be careful about the compromised anterior teeth. We're going to encroach on the anterior tongue space. Even though we open it up in the back now, we're encroaching on the front a bit when we add this anterior stop. And we're going to increase the vertical, which may be a disadvantage at times because increased vertical dimensions of occlusion are often less comfortable. Okay, when we might want to do an anterior stop and when would we not? First of all, why? The main reason we do this is we do believe it decreases the strength at which we can contract. It decreases the overall muscle soreness, and for patients that we may feel are going to have a problem with muscle soreness or now experiencing muscle soreness, it's a great design to do. We're going to decrease the posterior tooth soreness. It's not going to hit on those back teeth anymore, and for these real big time clinchers, we move the forces to the front, which are less, and it can help the tooth soreness overall, in particular the posterior tooth soreness. And if we want to increase the vertical dimension, there's no easier way of doing it in most designs than just adding it in the front, as opposed to adding it overall on both sides in the posterior. And one of the main things we may do this for are for someone who is fracturing our devices. Maybe they're cracking and we don't have enough room in the posterior. Now we can add an anterior stop, and this stop will take the forces, and our devices may hold up a lot better because we can move the force a little further away and prevent these devices from breaking in the back area. When we don't want to add the anterior stop, the number one contraindication is if we're concerned about the joint itself. If they have internal joint problems or crepitus or anything else that we may be concerned that this device may put more force on the joint, and that may not be wanted, we got to be cautious of that. And if we don't want to increase the vertical dimension of occlusion, then we certainly don't want to consider adding an anterior stop, because that's by design we're going to do that somewhat. Well, I hope that's pretty much the quick and easy on when and when not to add a mandibular advancement device, to add an anterior stopping point to it. And we hope that you enjoyed this version of Dental Sleep Medicine Insider, and let us know at Dental Sleep Solutions if we can help you with any of your dental sleep medicine implementation needs. Thanks a lot, and have a great day.